Hello, everyone. Welcome to the Medicare Cafe.
Welcome in. Good morning.
As you can see, the kids are in charge today.
No
Woo!
rules.
Yeah. Honey, I Shrunk Ourselves kind of vibes. We're going to throw a party.
I love that.
You said you had something to talk about. I know we kind of missed pre-cafe, but we're going to have one really quick,
Yeah.
so just bear with us.
So for the longest time, you guys know what Redbubble is? It's like a artist platform that you can make art and put up there.
You can buy like stickers and stuff.
Yes.
Yeah.
So for the longest time, my wife Emily has had a sticker that is a croc that she drew that says Croc Gang on it.
Yeah. As in the shoe.
As in, yes. The popularized rubber featured
Yes,
item.
as seen on TV.
Exactly. 1000%. I kid you not, since we've been together, so like 6-7 years now, she has gotten a monthly sale somewhere in the world that is Croc Gang. Whether it is a pillow, a shower curtain, stickers, like
because you can just use the design and then they choose
and
what
Redbubble
they want it on.
is like, yo, you want that as a metal statue? I got you, as long as you're willing to pay the price for it.
The shower curtain is so funny because it's one, obviously just like a funny design,
Right.
but then two, specifically, it's like, what does? It's just
Dude,
funny.
so
It's just
goofy.
funny. I believe it's self-explanatory. But hey, guys, welcome to the Medicare Cafe. Today,
Oh, wait.
what?
There was more.
Oh, there's more.
I'm
Oh my
so
gosh!
sorry.
But wait,
I'm
there's
sorry.
more.
As
Sorry.
seen on TV. The whole story. So she's made a sale every single month. Croc just sent her like a cease and desist.
No, I thought you were going to say like a PR box. Oh my gosh. Are you serious?
She got the message that said, "We're sorry, but we had to remove your artwork from the Redbubble marketplace under our IP and publicity rights policy. The rights holder is Crocs Incorporated. Subject matter, Crocs trademark. This is the affected artwork. Croc Gang."
Oh my gosh. I wish that people could see.
It's like you could tell it was drawn. Like, you know, that's
Yeah.
like, but yeah, it is.
Cease and desist from Crocs is crazy. What a crazy sentence.
Bro, and I'm a 100 Thieves fan. Like, that's so messed up. Like, so they're like a partner with 100 Thieves. But anyway, so
that was
was
funny.
my little morning tea this
No,
morning.
I love
so.
that. That is actually, I mean, no, actually, I kind of love it. I still kind of love it for her because it's a hilarious story.
Yeah, she made it big enough on Redbubble to require a big company to be like,
Crocs.
unless we're getting our cut,
No
more.
need to tick off Crocs, okay?
No,
you
I
done ticked off Crocs.
I love Crocs. Let me just make it publicly
You're
known.
like, I'm so sorry,
from
I'm
this
actually
point
just a
forward.
big fan.
In fact, I'd love to work with you moving forward. Medicare Cafe Crocs takeover. Now, wait. Now we're talking about.
Heather Shoe with Holes Gang.
Now you're onto something. Now you're something.
I wonder
like
how many
that.
viewers we've lost in the last.
If any, I mean, I can see the chart. It's only going up. I think we should say Crocs a couple more times.
Yeah. Oh my gosh, what if Medicare Cafe gets a cease and desist?
Oh my goodness.
Anyway, I'm Sadie. This is my number if you want to text me.
And I'm Benjamin.
Yes.
My number's not up there, so please don't text me.
It's not up there, but feel free to throw your questions, comments, concerns, threats, promises in the live chat. Everybody else can see it. So if you have a question that you don't want everybody else to see, that sounds crazy. Keep it PG.
Yeah,
you can
true.
text me as well, or if you don't have a YouTube account and you can't, go ahead and text that number. It shows up right here. I'll be able to answer your questions, but feel free to throw in your questions and comments throughout this. Let's go ahead and get today started.
Yeah.
Dang it.
And we expect some questions because we're going to be going over our frequently asked questions about events and seminars.
Which is probably the top. Well, I would say right now. No, I can't even say that. It is a topic that is hot all year round.
Yes.
But right now, it's very, very big with the agents that we work with because everybody is realizing in the past couple of years, people are realizing like, oh, these work.
Yeah.
These are something that we need to do.
100%.
So more than ever, we've been getting a lot of questions about these. So
I think it's really cool. Over the last year, I have an agent in particular, and they may be tuning in. So I'm talking about you. Like when we first started working together, they were very reluctant. They were like, events don't work. They're terrible. They're a waste of money. And then last AEP, they put on like 6 events. And I was like, so events, eh? Like they were like, you know what? I've got to tip it. Like they worked. They worked incredibly well. I probably could not have gotten through last year's AEP without them.
Yeah.
And I'm like, how cool is it to see a shift in someone that, I've been working with closely and have a good relationship with. But also I think that's where the industry is at. Is like there are events that need to be held in order to reach the masses, take care of the most people, and you as an agent just like stay sane. Because if you are not figuring out different or unique ways to kind of make it through these times of really wavering industry or some changes that are going on, man, you could your head's gonna pop off. Like it is so stressful.
Well, I feel like it's not even a way to stick out at this point. It's getting to the point where it's like it's a way to not be behind.
100%.
Like there is probably someone already in your area, if it's not you, like doing events and seminars for like seniors like this.
Yeah.
So honestly, it's getting to the point where it's not too late, obviously, to like jump in.
Yeah.
But in a year or two, I really feel like it's going to be like something that you have to do in order to like be in front of people like whatsoever.
I would completely agree. And as we're going throughout the cafe today, if you guys are either someone who has done events or has not done events, please try to take some time and put in the chat or text to Sadie, what is like the one barrier that you guys have that is keeping you from going through events? Part of what Sadie and I were talking about earlier was these frequently asked kind of segment for events and seminars. Yes, it's a huge conversation right now, but there's always going to be more questions to be had and asked about events and seminars. So we can either take that to the Facebook group that we have, or there may even be frequently asked questions about events and seminars part 2 in the future. So if you guys can take some time and just like, if you are someone who is reluctant, or maybe what was your barrier to getting into events and seminars if you're now doing them. So that is a huge part of kind of what will go on. And I can switch over to really one of the big first questions that we run into are, what are the compliance changes that we can expect this year that will affect seminars and events?
Which, of course, this is always a big question because the last few years, it's just like back to back getting hit.
Bam,
We've just been taking punches in this industry with compliance changes and specifically compliance changes around events and seminars and all that fun jazz. So it's a super common question. We're going to keep having it. But this year, thank the Lord, is actually a very easy answer. And that is, we don't have any.
None.
Not yet. And just to make you guys feel better, I did double check with Olivia and our compliance officer, Chaylin. Double checked with him this year. I was like, is there anything that we're missing? Because I don't think. And he was like, nope, not this year.
Yeah. The final rule, from my understanding, and like Chaylin is 100% right in that, it's not being really touched at all. They took a lot of their drastic changes over the past couple of years, and it's not seeing any big changes. So you're just gonna have to find a different excuse to not do events this year.
True. DB, this is a really good question, actually, because that is our next one. Honestly, we can just move on to the next one because we don't have any compliance changes for this year. How do I actually get people to attend my events? This is a really big question because you can do all the marketing that you want. People have this problem where they say, well, I tried it and it didn't work for me. I can't actually get people to my events. Yeah. And obviously, it's all about ROI. Like, you're not going to get a return of investment if you aren't even getting people there. So how do you actually get people to your events?
It is a tail longer than time. Is that how you say that? Is that the right
tail
phrase?
As old as time.
As old as time? This tail might be longer.
Okay. Than Father Time?
Than Father Time himself. So I think the biggest key, and Sadie, you touched on this kind of a little when we were discussing earlier, is literally consistency. Like, through multiple different like options and facets. It is consistency in when you are doing your events and seminars. It is a consistent theme from many times to what you are presenting. Because if you go from talking about, Pink Pony Club, and then your next seminar is a Medicare 101, that crossover is maybe higher than I would initially think, but probably not as high as we would hope. being consistent in how you're reaching folks. I think also it's going to call to the agents that you need to find different ways than what you've done in the past as well. So I'm going to challenge consistency with also getting incredibly creative and unique moving forward. I have an agent that we are working with, and I will shout out Summer from the pod that Agent Resources houses, but she has been working very closely with an agency that actually just last Friday had one of their first events that they have ever put on as a whole. And it is nerve-wracking. It is scary to try something new. And hey, with the amount of time and investment that we're putting into something like this, I mean, they were on YouTube channels. They were doing interviews with other podcast hosts. They were line dancing on YouTube. They were getting flyers out. They were doing a little bit of everything. And it makes me smile so hard to say that, like, rough numbers, they had 140 people attend their first event ever.
Love.
They did a
Yay.
whole senior expo. They had vendors. It was absolutely amazing. So, like, I would challenge, DB is Diane Barnes. So, hi, Diane.
Hi, Diane.
So one of the things that I would challenge is, like, what are you doing now to get people into your seats? When was the last time that you had reevaluated that? I think flyers and stuff is still really good. I would argue that one of the most important key factors that you can do, and we talk about it a lot here on the cafe, is strategic alliances. You can fill a lot of seats with a small amount of questions are asked by going to an HR department, a doctor's office, one of these partners that you've been working with for a really long time, and say, hey, I'm putting this on. We would love to fill as many seats as possible.
Yes, they're talking to their people, you're talking to yours. Also, I would say, like, adding in strategic partners and doing events like that will help, just because sometimes that's like a change of pace. If all you're doing is Medicare 101s, that's consistent. But if you're consistently doing something that is showing that it's not working over a fair period of time, because that's another thing. People are like, well, I have been consistent. I've done this like twice. And it's like, girl, we got to keep doing it and doing it and doing it. I also feel like sometimes people aren't even just like mentioning it. They're like, well, I put something out on Facebook and no one came. Or like, I have a poster up and are you talking to everybody that comes in and you're saying, hey, I have this going on? Eugene asked a really good question. Should they be promoted as Medicare information meetings versus a seminar? So it kind of depends on what you're talking about, but for the most part, seminars are there. This is a good question because seminars can be used as kind of like a mass, not appointment, but like an appointment as far as like
100%.
what information you're sharing. So like ANOC meetings, those are really, really wonderful because instead of having to do that in every single appointment or call everybody, you're able to sit everybody down at once and you're able to tell all of them. So promote them. I guess it kind of depends on on how you phrase it, and depending on what you're actually talking about.
100%. I think I would reel back and even say, like, what type of event or seminar are you putting on?
Yeah.
So, like, I think there are 3 distinctive types that we like to talk about. One being educational. So that might be one where you could outline it as a Medicare information. I generally avoid using the word Medicare in any of the titles just because it is very common to see that correlation. If that's in your title, they're going to assume that you might be from Medicare, and that's what we need to avoid. We need to not misrepresent what this educational event is, and it's merely an agent's perspective or providing education on the topic of Medicare instead of someone who's from CMS, from Medicare, actually attending. So I would be hesitant on using Medicare in the actual title. To some degree. Obviously, there's like Medicare 101, like that type of stuff. Just making it abundantly clear that there isn't an expectation with the viewer or the attendee doesn't expect someone from Medicare to be there. So educational is one of those. Then you have sales events. Those are generally and have to be partnered with a carrier or do some type of registration to get those through. That's where you're discussing actual plan benefits specific to a singular plan within that. And then the third one that we had previously discussed and talked about is a marketing event. And that's really just kind of getting your name out. We're kind of shifting some of our verbiage from that, from being a marketing event just because it caused some confusion in the past. We're going to refer to those as an agency event moving forward. So something where you or your agency is being advertised, a home and garden show, places where you are trying to just get your name out and outline, hey, these are the services that I provide.
Yeah, exactly. Before we move on, we've kind of talked about it a little bit as far as like the different marketing things that you do, but we talk for anything marketing, not even just for seminars, events, for just marketing your business. We always tell people, make sure you're not putting all of your eggs in one basket.
Yes.
We say 3-prong approach where you have 3 different marketing tactics going on.
The marketing trident.
Yes,
if you will.
the marketing, if you will. I won't, but if you will, have those going on and then change them up like quarterly. Yes. So the same thing is going to apply. I'm not saying you have to have 3 different ways that you're marketing these events. I don't think that's a terrible idea. But if you've tried marketing them change it up. Change one of the prongs. If you haven't been putting it on Facebook, start putting it on Facebook. Make videos inviting people. Make sure that you're handing out flyers every time someone walks through your door. Put up flyers in like a senior center or
100%.
Something like that. Go to them. Again, even like a marketing, thinking of it as like marketing is like going to your networking partners and changing that. So you just have to change things up after a while, but you have to be consistent and make sure that it for sure isn't working. So we normally say for overall marketing, give it like a quarter. Yeah. And that kind of helps out. And if you're starting events like right now and you're kind of doing them through the summer, just random things, this is a great time for AEP.
You should
figure out, to figure out like what's working and what's not. But yeah, change it up, be consistent.
Yes.
And then after you're consistent, you've given it a good, fair shot. Figure out what you need to change up.
You can't have good data points without enough data being collected. And I think that's apart from being consistent.
Yes,
is like
that's a good
provide the opportunity to see what is working and what isn't working. I'm going to put Diane back on the spot because I know they do a bunch of online and virtual appointments through their Facebook and all that type of stuff. They do an amazing job. I think a huge part of that is making sure that, how can we get people to attend that is maybe occasionally going non-virtual and offering one here or there. And then, maybe every 4th one is non-virtual. There are going to be people that like an in-person event. There's going to be people that want to go make a day of it, have some time set aside to have fun with some of that. So I know you guys do a lot of virtual events and I love the virtual option. But I think there is something to be said about, having true physical butts to seats and being in front of someone. If you only have a virtual presence, I would not be surprised if, I've never met with them, I've never seen them. And I know that's not the case for Diane and her crew. So just something to think about. It's being different in the space, being consistent, but there are things that you are going to have to do. I was actually talking to one of my coworkers about this earlier, is like, you guys do not have to fit a one-size-fit-all in what you're doing. It is okay to do something like 80% this way and then cater to the 20% every other time. We were discussing this specifically for like how to do virtual enrollments or virtual appointments. And we were finding that a lot of agents are like, well, we can only do enrollments this way.
Yeah.
And it's like, well, why? Why are we limiting the capabilities? If we offer 2 ways instead of just one, wouldn't you rather reach 95% of your people instead of only the 65% you're going to with a singular way? And I think some of it is going to get called into question. And I think you can apply that to events and seminars. So, if you're only doing events one way right now, get creative, find a different and unique aspect. So,
yeah, I agree. Our next question that we have,
it didn't work.
What materials can I hand out? This can feel kind of broad, just because there's a lot of different kinds of events, so it depends. But This is a question that we get a lot because people are worried that it's like, okay, I know that I have this kind of event. It's registered with this, where it's not registered with that. But am I allowed to hand this out?
Yeah.
Like, there's so many. This is one of those things where it's like it can make people too nervous
Yes.
to actually get into seminars. They're too afraid, or events. They're too afraid.
Yes.
So yeah, Ben, what do you think?
I think it comes to the intentionality of it all. So obviously, you can't, as everyone is seated in front of you, pass out a scope of appointment, and this is when your next appointment will be with me, and here's $100 for showing up to my appointment. Now, obviously, those are things you can't just provide to anyone that shows up. But I think depending on this, so let's kind of break down the seminar types again. So educational. So you have all these pieces. It is completely okay to have, good and documented pieces. I generally recommend trying to stick to ones that have like the CMS logo, because the information on that is going to be good and accurate. So there's a lot of those pieces that come out through Medicare.gov has a whole like publicity site where you can get a lot of those pieces that have some one pagers. Those are really good. Working with your upline, they as a value add to you as an agent should be helping you. I know, Eugene, you mentioned this a lot earlier, like what assistance does SMS or senior marketing specialists offer when it comes to events of this nature? So there are a lot of educational pieces that we actually have curated to be paired with our seminars and events. Through all of that, we have seminars in a box. So we curate and have compliantly reviewed a presentation. That way you as an agent don't have to stress about, okay, well, what am I going to present? Does it look good? Is it compliant? And we kind of take some of that off of your guys' plate. Your main goal should just be showing up, being on time, and being comfortable and being personable while you're there. You guys do know a lot of this stuff. I trust yourself in that you do. I think that's another thing. You mentioned a little bit of like, there's some hesitancy when it comes to what can I hand out? Is this compliant? And it is nerve-wracking. And truthfully, you should be a little bit nervous because you want to make sure you're doing it right. There is a value to that. But also, through all of this, like, you should just be going there. You guys know this stuff. You guys do it on a day-to-day basis. Trust yourself a little bit, because if you're still in business today, arguably you're probably doing it at least well-intentioned enough to still be in business. So don't sell yourself short. You guys are super knowledgeable. So kind of educational side, making sure you have all these pieces. Sales events. So generally that's going to be tied up with a carrier. Reach out to your carrier representative. The amount of resources and things that they could have ready to be handed out or hung up around the auditorium or wherever you may be hosting. There's a plethora of options that get opened up to you when you're working with your carrier representative. And then marketing side is really just trying to avoid some of the Medicare side of it completely. Stay 30,000 foot view when you're working on, hey, these are the services I provide. Just say like, hey, we do maybe, Medicare health reviews, instead of saying, oh, we'll sit down and we'll take all of your prescriptions and then we'll go through all the options and figure out what the Part D, buyout deductible, all this type of stuff is going to be. So those are kind of the three different views of what that's going to look like. Generally, one thing that I would also outline is you're not supposed to really pass out business cards, permission to contact. Now, there are some events that allow that, but not necessarily passed out. What I would potentially go on the record for and say is like, just because you have these things available at your event doesn't mean you pass them out. So if you just so happen to have a table that may have like refreshments or snacks or water, and then you make your business card or a permission to contact form available to the client, you're allowed to make things available to them, as long as you're not pushing them to them or encouraging them one way or another to take that. You can't incentivize that type of stuff, but you can make those materials available to them in the event that they ask.
Now, to be a bit more specific, so
Yes.
we're like, what can I hand out? What can I not? Permission to contact, which you guys know this, but just a reminder, Permission to contact forms are different than scope of appointments. There
True.
is going to be a bit more of a consequence for scope of appointments. Do not hand out scope of appointments. Do not have those unless it is a registered sales event.
Yeah.
Meaning it is registered with a carrier and all that sorts of stuff. Anything else, just don't even have scope of appointments around.
Correct.
Can't do that. So make sure that you aren't having anything like that. For registered sales events, that is a really great time and probably the only time that I would recommend having carrier branded stuff at your event out personally. Just to make sure that everything is good. But like he said, that's a really good time. Registered sales events, whenever you're working specifically with a carrier, ask the carrier, get some things off of the portals and whatnot to have those out. Those are really great materials. For anything that's not registered, so this could be educational events. Sometimes educational events are registered, but for marketing events and stuff like that, yes, have available the information in which they can contact you. And then you can also have things that aren't tied to Part C and D. So things like Medicare and You handbook. That's not tied to a carrier. It's not plan specific or anything like that. You can get those for free off of Medicare.gov, have those available for people. So anything a bit more generic like that, that's when you can really rely on CMS.gov, more like Medicare.gov. Those are really good things to have out. But yeah.
Yeah, choosing a Medigap policy would be handbook would be another good example. There's a lot of different pieces that you can make available. I think through all of this, we talked about what's it look like to get registered, or these registered sales events. I think having that relationship with your carrier representative, we're huge fans on here, whether we're having carriers come in and discussing with them. You guys need to have a relationship with your local representative to some level or not. They're the person that may even come and speak to one at one of your events if it's a registered sales event. And you mentioned maybe avoiding some carrier branded items. The only maybe counter I would have is if you're doing an agency event and you wanted to have maybe like the carriers you represent and like swag items.
Yes.
But that's very different, obviously, than what you were outlining.
Yes.
So,
no, I agree with that. That's a good clarification.
So make it, it's not like a end all be all, don't have carrier stuff at your items.
Right.
But
yes,
generally,
that's a good clarification.
Advertising who you work with, what you service, that type of items, that would kind of be a secondary recommendation. And all of that can be done through your partnerships with carrier representatives.
Yeah, even like we've talked a lot about like seminars, but the event side of it where you're having like client retention events, you're doing different things. You can even have those sponsored by carriers. So 100%. Sometimes it's like, you're kind of going to be decked out in certain carrier stuff because Cigna said, this is just random. Don't go asking Cigna. I don't know what I'm promising, but generic carrier A sponsors your like barbecue or whatever, something like that. So you might have a rep there and you have their stuff all over the place. So it depends, but anyway.
Yeah, no,
I feel like we hit that.
No, I think that's perfect. And Tom mentioned, so pre-COVID, I did ANOC meetings and had over 50 people attend. After COVID, I get 1 or 2, if any, people attend. What can I do to increase attendance? It's a great question, Tom. So where I would tackle that first is we are very much so in trying to compare apples and oranges. Pre-COVID to post-COVID are very different times. So what may have worked prior to COVID may not work as well as it did now post-COVID. Trying to figure out, I will say, now that I've kind of put that into the space, I think we are getting closer and closer to what things were like pre-COVID. I know we're doing way more in-person events, trying to get more access to the public, just kind of getting back into that rhythm of things. So my question would be, what were you doing prior? And have you reviewed that or, tried to change that? Also, knowing that general success for events looks very different than you're not going to sell out a huge baseball stadium. I think that is, we talked about consistency, but I think you also have to be realistic. Celebrating 5 to 10 people attending an event of sorts is a huge success. Then you need to work on what percentage of them was I able to meet with, and then what percentage of that was I able to close. So if you can have 10 that you meet with, or that you have attend your event that you have on a bi-weekly, monthly basis, but you don't close any of them, yeah, that's going to stink. And 10 people is not really that good. But if you have 10 people and you're closing 80% of them, that's 8 additional sales every 2 weeks or every month. I mean, shoot, that's 2 apps away from like our cost share marketing dollars at Senior Marketing Specialists. If you're doing 2 more apps other than that event and seminar, we can help you try to get, more leads or more, marketing dollars into your funnel. I think that's the other part. So, working with carrier representatives, working with your upline, there are a lot of resources that they can work on, whether that be trying to cost share some of the cost of putting on, you talked about having sponsors for certain segments of the events, whether it's carriers, whether it's gyms, assisted living programs, Edward Jones. Like, there's literally so many different options of people you can ask to have a table. The most recent event that I was talking about earlier with the agency that Summer has been working with, they had a little bit of everything. They had a caricature drawer at the event. They made it like a full senior sales expo, which was really, really cool. They had line dancing. They had like a hearing specialist. They just did a little bit of everything. So don't leave anything off the table until you ask.
Yeah.
And so I would take a look at that, Tom, specifically. What were you doing pre-COVID? What are you doing now? And then I think we recently connected on LinkedIn or whatnot. So you can shoot me a message and we can kind of go back and forth on what that might look different, because it will need to look different.
Yeah.
That's, at the end of the day, that's the kind of the answer.
And sometimes it even just comes down to wording and like what you're telling people in your intention with these events. So are your ANOC events the time in which like for you, you're like, I'm not going to go through this. I mean, I will, but the intention is to not go through all of this whenever you come to the meeting. The ANOC meetings are where you get that information. So obviously you can't force anybody to come, but using your wording of like not saying it's required, but making it clear that this is where I'm getting all of the information out. Setting the expectations that your appointments during AEP are going to be shorter and offering it multiple times, but a limited amount of times. Yeah. So okay, for this carrier, I'm going to offer this meeting at this time and this time. So that way there's urgency in saying, okay, I don't miss it if I just have this one, but there's not very many chances to go. So I need to sign up. So sometimes it's just about, that was kind of like a long way of saying, think about how your intention behind this event. Is it something where you're trying to tell the masses because you're not going to be talking about it in your appointments, or is it something that you're just kind of like, oh yeah, I don't know, like people can come if they want. It's an optional event. Yeah, of course, like be careful with the wording. You can't force people to come, right? But making it clear, this is whenever I'm going to be talking about this. You don't want to miss this event. Just being careful with your wording there.
The consumer behavior side of all of this, so that's part of like what my major is in, is consumer behavior, is something that is always available to someone will almost never be utilized. So I love that you mentioned like truly have intention behind these events and offer it at multiple available options, but not forever. So I think that's something that people see. If they know it will happen every day at this time, there is almost no urgency to attend one of those because there will always be one the next day. Yeah. So I think it's being very intentional about what that looks like. Tommy, also, if you have these same clients that have been with you through and through, I would also pose the question as to like, the people that had attended your initial ones, were they all new to you and they weren't captured? Or are those now current clients? Maybe you have an ANOC event that is just your current book of business. Your goal is not to try to get new clients out of that, but it's to educate, the masses of your current book. So lots of different ways that you can take a lot of this. The biggest question is that you guys have to be thinking about these types of things. There has to be a unique and creative way to get in front of a larger percent of your book of business and outline the change that is happening this year. Otherwise, you're going to have to play catch up, and no one likes to play catch up, especially during quarter 4. So,
yes, exactly. Those are the questions that we have for today. We asked this question actually to our coworkers, and we said, what are the questions that you have, or what are the questions that you get the most? So we actually have a list of questions that we could go through. We just chose a few today. So maybe we'll continue this on in a series, maybe not. Kind of depends on the next host. But we get tons of questions. Again, we got a lot of questions in here today about events and seminars. And we really want you guys to feel comfortable and feel like you have the tools, because you do. If you do this job, you're good with people. And so it's just learning how to do it in a slightly different environment and format. And so we'd love to help you out with that. But in the meantime, go and join our Facebook group.
True.
We have a Facebook group and we have a Facebook page. Facebook page is just us putting some information out there. A group is something that's interactive and that you can be part of. This is where other agents like you that are part of the cafe family, they are in that, and we can ask questions, we can interact, all that sorts of stuff. It's a nice, safe place. And it's a closed group, so you won't be able to see it or interact with it unless you join it. True. And we won't spam you. We have policies, okay? So you won't get spammed by a bunch of different stuff. We're very careful about that. So join that group on Facebook. We would love to have you. But I don't know. Do you have anything else?
I think the only thing I was going to add is incentive to join that group is we have a really nice white paper that kind of breaks down these different styles of events. So educational, sales, and agency style events. That Sadie had curated and put together that is absolutely gorgeous, that I will be making available in that Facebook group. So if you guys would like that type of resource, just type in Medicare Cafe agent, and that should get you pull that group up, and then you can request. It gets sent straight to my phone. I can approve you as long as I recognize you, or if you answer the question. So just making sure that's all taken care of. So just a little extra added incentive to join our cool group.
Cool.
The Cool Kids group.
Okay, guys, we will get you out of here because we're yappers and we could talk forever.
Truly.
So until next week, have fun.
Make money and give impeccable